Influenza is a microscopic organism that causes a great deal of human illness every year. Across the globe, lower respiratory tract infections are the fourth most common cause of death after coronary artery disease, chronic obstructive pulmonary disease, and stroke. Approximately half of all respiratory infections are due to respiratory viruses such as influenza, respiratory syncytial virus, parainfluenza virus, coronavirus, rhinovirus, and human metapneumovirus. Worldwide, influenza is estimated to result in an annual 3 to 5 million cases of severe illness and up to 650,000 deaths. Influenza A and B viruses cause the majority of human disease around the world, and influenza A virus subtypes are distinguished by two main surface proteins called H and N that continually undergo genetic change. This continuous genetic change of the proteins requires year-round surveillance to inform the seasonal influenza vaccine formulation. Influenza viruses are found in aquatic birds and waterfowl. These birds are considered the reservoir host for avian influenza. Reservoir is where the virus typically resides before it infects humans. Pigs can be infected with swine influenza viruses, human influenza viruses, as well as avian influenza viruses. Mixing of these influenza viruses, either in birds or pigs, makes it possible for the genes of these viruses to create novel and often lethal virus combinations, such as the 1918 Spanish influenza pandemic that killed up to 100 million people worldwide. In the United States, the influenza season occurs during the fall and winter months, with a peak somewhere between November and March. In tropical regions such as Singapore, the influenza virus circulates continuously, and there are two peak transmission periods, one from May to July and the second from December to February. I'm happy to report that the number of influenza cases appears to be decreasing. The average daily number of patients seeking treatment in the polyclinics for influenza-like illness decreased from approximately 3,200 the first week of March to 3,000 the second week. The most common strain currently being isolated in Singapore is influenza B. First and foremost, vaccination. It's never too late. Trivalent vaccines are made to protect against 3 influenza viruses: an influenza A H1N1 virus, an influenza A H3N2 virus, and an influenza B virus. There are also quadrivalent vaccines to protect against 4 viruses. For everyone 6 months of age and older, the Centers for Disease Control and Prevention recommends annual influenza vaccination as the most important step in protection. Flu vaccines cause antibodies to develop in the body about 2 weeks after vaccination. These antibodies provide protection against infection with the viruses that are in the vaccine. Besides vaccination, the cornerstone of influenza prevention is virus avoidance. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand rub. Try to avoid touching your eyes, nose, and mouth. Disinfect frequently touched surfaces at home, work, and school, especially if someone is sick. Practice and encourage good respiratory etiquette. Make sure you cover your nose and mouth with a tissue when you cough or sneeze, and throw the tissue directly into the trash to avoid contaminating environmental surfaces. If you do unfortunately happen to get sick with an influenza-like illness, please stay at home to help prevent spreading the virus to your coworkers and community. The Centers for Disease Control and Prevention recommends that you stay at home for at least 24 hours after your fever is gone, off of all fever-reducing medications.